Hello, I'm Ehud Asya, and I would like to talk about the APX 200, a novel pupil dilator, which was designated to provide pupil dilation in cases of small pupil or IFIS. The APX has been inserted through two opposite 19-gauge stab incisions, which is just a little bit larger than the routine side port incisions. The coronal incisions should be done parallel to the iris plane. The APX should be inserted into the anterior chamber until the pivot pin is inside the anterior chamber. And then it is slowly opened about halfway until the distance between the distal tips of the APX is approximately the size of the pupil. The terminal tips should be located behind the iris, and it is usually advisable to position the tips one by one and not the same at the same time. When the tips are on both sides are properly positioned, then slowly release the forceps and allow the device to open up completely. If the tips are not positioned properly, then the procedure is simply repeated using the same designated forceps. Regrasp, close, open again halfway, position the tip properly, and then slowly release the APX. No intraocular manipulations are ever needed using either iris hook or any other instrument to position the APX, either during the insertion or during the removal. There is no need to tilt the incision backwards because the design of the device is such that the tips are bent a little bit down, so the shaft of the expander can be just lying parallel to the iris. Incisions, when they are made opposite to each other, create a quadrangular opening. If we have two, one opposite to the other, it's open up like this. If the incisions are done a little bit asymmetrical, for example, instead of 3 and 9, it will be 230 and 930. In this case, it is going to create a trapezoidal shape opening. Instead of quadrangular, a trapezoidal shape opening with a wider base facing the surgeon. And this provides much more space for the surgical instruments. It is advisable to inject a cohesive OVD not only into the anterior chamber but also behind the iris and to create a space between the pupillar margin and the lens. Surgery is generally done using routine surgical instruments and routine techniques. The APX does not interfere with any surgical maneuver. Even if the instrument, such as a chopper or iris hook, is overriding an arm of the device, there is no problem and the APX does not interfere with surgery. Removal of the APX should be done prior to removal of the OVD, and to remove the APX, one uses the same designated forceps. The APX is grasped, closed, and pulled out, and it typically takes just a few seconds. Once again, note that no intraocular manipulations are ever required, either to position the APX or to remove it.